Thank the witnesses today also. You know, as a business owner for approximately 3 decades, I often wondered why some of this legislation would come out of Washington, and then I realized that many times legislation comes out of Washington by people who have never have to live with it. But as a small business owner for almost 3 decades, I had to, and I understand the struggles that small business owners are going through on a day-to-day basis, especially with the ACA and with the hour requirements. And I also realize that every day they have to make decisions on whether they lay people off, whether they are going to add people, what are they going to do next. And I also, coming from Ohio, Cleveland, Akron, Canton area, get the opportunity to go back on a weekly basis. So I'm talking to these people, and it is shocking when I hear many of my colleagues on the other side say this isn't affecting some of these people. So let me just give you some examples in my district and in the Cleveland, Canton, Akron area of what's going on with the hours and the Affordable Care Act. The Cleveland Clinic, which is ranked among the top 4 hospitals, has announced layoffs of employees as a direct result of the Affordable Care Act. Summa Health Systems laid off 58 workers in September and another 25 in December. Akron General Health System, Summit County's second largest employer, laid off 132 workers in February and another 30 in September. The City of Akron, the City of Medina, the City of Fairlawn, the City of Talmadge, the City of Westlake are limiting part-timers to fewer than 30 hours per week. Cuyahoga County Community College capped hours for 1,559 part-timers at 20 hours per week. Kent State University limited course load of adjunct faculty. Medina City Schools cut weekly hours for cafeteria workers and teachers' aides from 30 to 28 hours per week. Stark State College capped hours of adjunct faculty at 29 hours per week. University of Akron cut course loads for part-time faculty. A local tavern in Canton, Ohio saw a 32% increase in its projected premiums after the employer mandate was delayed. If their premiums increase again, they will have to look at a reduction in workforce or stop providing health insurance to their employees. Claudia from Cleveland wrote and is concerned over losing her employer-sponsored health coverage. After previously being laid off from a full-time job, she accepted a part-time job at a JCPenney's that offered her affordable health care. However, her employer has now stopped offering insurance for part-time employees due to the ACA. John from Wadsworth, a small business owner, he wrote to tell me that he will not be able to offer insurance in the future due to increased costs as a direct result of the ACA. You know, but most recently, and this is when I say I go back and I hear a woman working at the counter at a local restaurant in my hometown said to me, "Congressman, I've been here for 22 years. I've worked 32 to 35 hours per week. I love my job. I enjoy my job. Now, because of the ACA and the skyrocketing costs, we've been told that all of our staffing will be reduced to approximately 28 hours per week." That's approximately a 15 to 17% pay cut, plus she's going to lose her health insurance. So now she said to me, I have to go on the Affordable Care Act. She looked at me, she said, "I'm scared." She says, "Can you help me? Can you overturn this law?" These are the kind of things that you hear when you go back to the district. But when I'm in Washington and I hear some of my colleagues, I never hear that. But this is what you actually hear when you're dealing with these people. And you're back there listening to them. It's amazing. You know, I worked in the healthcare industry most of my career. I had nursing homes, and I saw your statistics on how they're going to be affected. I think of those over 1,000 employees that I employed, and look at those nursing assistants. Many of them single moms, 35 hours per week that earned approximately $411. If the nursing assistant hours are cut back to 29 hours, he or she would lose $71 per week, or equivalent of 17% pay cut. That's unheard of when we're thinking of these single mothers and fathers that are trying to provide for their family. I go back to certainty and predictability, and I would ask this general question. As a business owner, you need certainty and predictability. I would ask all the panel members, do you believe the ACA in this hour situation brings certainty and predictability to the small business owner?
Absolutely not, Congressman.
No, not at all.
No, sir.
No, sir.